Why do doctors lack empathy? Why do they seem to not care, to be so dismissive of our complaints and our emotional needs? We've all had negative experiences with doctors at times, including myself, and I want to talk about my experiences both as a patient and a doctor. But first, I want to show an interesting response to a blog post by Dominic Shadboldt. If you don't know who he is, Dominic has had multiple sclerosis for 27 years, and he runs the YouTube channel The MS Guide. I'll put a link below. And he talks about his experiences with multiple sclerosis. And he made a very interesting comment on a blog post by Professor Gavin Giovannoni's his multiple sclerosis research blog. And I'll post that blog post below in the links in the comments. And it's basically about certain high efficacy disease modifying treatments and their lack of availability in the United Kingdom. And these treatments are Limtrada and hematopoietic stem cell transplant. And because of regulations, generally speaking, people with MS are not able to get these treatments unless they fail other disease-modifying therapies, often leading to permanent neurological disability, and Professor G is essentially criticizing this practice. And here is the comment by Dominic. What we are all forgetting in this debate is how bad MS can be as a disease, and most of the early damage occurs occultly before people with the disease and their close ones realize the extent of the damage. What is lost in MS is lost forever. We have no magic treatment that can repair the damage and turn back the clock. One of the great frustrations with MS is trying to communicate just how god-awful it can feel. There seems to be a general level of dismissiveness of the physical sensations, the mental sensations, and the screaming frustration at having the best treatments seemingly withheld until a certain level of irreversible decay has taken place. I had a conversation with a fellow MSer recently where we fantasized about interrupting their neuro out of the blue in the midst of their day. We'd blur one eye, send endless spiders crawling up one leg, start a repetitive electrical sound in one ear that came and went without warning, deprive them of sleep for several days, weaken a limb, induce numbness in a few random parts of the body, end their career, etc. You get the idea. There was no malice in this, just a desire to try to help them understand a bit of what it can be like. When they, understandably, freaked out, we'd then tell them to buck up because it'll pass. When? No idea. A repeat? No idea. Drugs? Treatment? Sure. But let's not be too hasty. These are costly things with a litany of scary side effects, so best not to rush into anything. Have you met our lovely MS nurses? They'll see you through the decline. I believe they are running a self-catheterization class next week. It feels like being trapped in a Kafkaesque nightmare. How can a highly educated, allegedly compassionate doctor be doing anything other than trying to help the patient make MS as small a part of their lives as possible? Because I have MS, the matrix through which I apply judgments over risk has lurched far from that of many doctors. I loathe it when they want to overlay their conservative treatment approach onto my deteriorating brain and body and then try to shield themselves from taking a tough and possibly risky decision by quoting guidelines and the occasional horror story they dredged up and reserved for these instances of the uppity patient to justify their unwillingness to treat my MS as aggressively as possible. I'll get off my soapbox now. And Dominic isn't the only one with this experience. There's a lot of evidence that doctors are often more conservative than their own patients. For example, there was a study done on the drug Tysabri that people with MS were more willing to tolerate a higher risk of PML, progressive multifocal leukoencephalopathy, a rare brain infection caused by the JC virus, which is a rare side effect of Tysabri. And it turned out doctors were willing to tolerate only a lower risk compared to their own patients. Because I think there's a certain psychology where if my patient doesn't do well in terms of their disease, I could say, well, it's not really my fault, it was the disease that did that to them. Whereas if I give them a treatment that causes a side effect, I feel very psychologically responsible. But in a way, perhaps they're one in the same. The other aspect is just the way that doctors communicate with patients, and sometimes they do it very poorly, making it clear that they lack empathy, or at least giving off that perception. And I want to talk about one of my own experiences over 10 years ago, and I'll just say this was not at my current institution. But I had a bad sore throat, and I went into an urgent care center. And the reason I went is because I knew that if you have strep throat, it's a good idea to take antibiotics because sometimes it can turn into rheumatic fever and even increase the risk of rheumatic heart disease later on in life. And so that's all I wanted, basically, to be assessed for strep throat. And I remember being in the doctor's office and him just being so dismissive of me, like I was completely wasting his time. And I remember him saying, like, you don't have any of the findings of strep throat. You don't have lymphadenopathy, you don't have fever, you don't have petechial hemorrhages on your palate. And I was like, okay, I'm just getting checked out. I wasn't even asking or pushing for antibiotics at all, and he probably spent less than 5 minutes with me. Anyways, I remember that I did the swab for strep throat, and he prescribed me antibiotics anyways, just so he could get rid of me faster, which I didn't even end up taking. And believe me, I wasn't being pushy, and I didn't even mention to him that I was a doctor. I wasn't expecting some kind of special treatment. And that experience sticks with me to this day. Now, I don't know what happened to that doctor. Maybe he's usually nice and he just had a bad day, or he was very behind and I was the least sick person in the urgent care. I honestly don't know, but we tend to remember our negative experiences. And that being said, I've had a lot of positive experiences with medicine, and I remember in my youth I had a lot of really good experiences with doctors, and I always had a lot of respect for them, and they were usually able to help me, which is one of the reasons that I went into medicine. So it's not all bad. But as I reflect on my own career, I can see changes in empathy even within myself. So I remember when I was a first-year medical student having my early clinical experiences. I was shadowing a family medicine doctor, and I remember thinking just how important every interaction was with every patient. I was thinking we can prevent heart attacks and strokes and treat a variety of medical conditions, and we prescribe medications people may take for years and give them advice they may contemplate over for weeks, even if we only spent 15 minutes with them. And we had to reassure them and make them feel confident and have trust in us. And then as a third-year medical student, I remember my early clinical experiences. See, in the United States, traditionally, the first 2 years are mostly academic, like textbook learning and lectures. And then it's no longer schooling. You sort of work as a doctor in your third and fourth years. And my first rotation was in internal medicine. And I actually remember my very first patient. I remember her first and last name even now, and this is over 10 years ago. I remember what she had. She had a gait disorder, and we thought she could have had normal pressure hydrocephalus, coincidentally a neurological disease, even though I didn't know I wanted to be a neurologist at the time. And I remember the different tests we did, a large volume spinal tap, and I talked to her for hours. I knew all about her family. I knew she had gotten divorced because her husband cheated on her, and she had a dispute over the finances with him. And I remember just how close I felt with her, how much I cared about her outcome. But then over time, of course, it's easy when you just have one patient. It just became more and more difficult to sustain that, to be as close to each patient. And with subsequent patients, it was so long ago, I can hardly remember them except the most distinctive cases. Then I remember later on, my first night on call in the emergency room as a resident. And I remember having this tremendous energy, again feeling I'm a real doctor now. I really have to be on top of my game. And I remember just working a mile a minute harder than I ever have in my life, now having that responsibility of a doctor. And the first patient I saw was septic, and we had to get the central line in, get IV fluids, get the right tests, the right antibiotics, send him to the ICU. And he was a young guy, and we kind of turned around his septic state, and he eventually did well and got discharged. And I saw several other patients, and at the end of the night, instead of feeling exhausted, I felt energized, satisfied, like I had made a positive contribution. But as time went on, those calls and calls exhausted me. I just wanted to have a quiet call with less patients. I just wanted to get a little sleep. I just wanted to be able to go home instead of working from 6 to 7 p.m. on a non-call day. I just wanted to be able to get out a little bit earlier, to take a jog, to call my future wife, to spend a little time with my family, or watch a little TV. And it just became exhausting, and it was hard to have so much empathy, so much emotional energy. And I remember early in my career, diseases like multiple sclerosis were just so fascinating and important to me. But now that I've seen thousands of cases, even though of course I care about the fate of my patients, it's hard to have the same degree of passion for it. Obviously, I still have passion for it, or I wouldn't be doing what I'm doing now, but it was just such an interesting disease. I would be reading about it every night, and it's just hard to do that. It's more sort of normal to me. It's more routine to me, even though multiple sclerosis is a rare disease. Only about 1 in 350 Americans or less actually have it. And what Dominic says is true, that many of the symptoms I cannot objectively experience. They're invisible. Cognitive symptoms, pain, fatigue. There's no way I could truly understand what it is to have multiple sclerosis, even though I've seen thousands of cases and sort of understand the diversity of the illness. And of course, it's not as though I have any question that these symptoms are not real. It's just that I can't objectively feel it. And I'm one of the young, enthusiastic doctors with perhaps 30 years of career in front of me. I'm one of the 40% of United States neurologists who is not burnt out. I make videos about MS during my lunch hour. What's going to happen to me in 20 to 30 years? It's a scary thought. And it's really difficult to come up with solutions. And I'd be interested to hear your thoughts, and I want to know your experiences with empathy from doctors and your suggestions about how to improve it in the comments below. But I have a few ideas. One is that I think sometimes doctors just work too hard and they really burn themselves out unnecessarily. When you're working 80 hours a week, you become grumpy, sleep deprived, stressed, and selfish, and it's really hard to go that extra mile. But when you give yourself a break, when you balance your schedule a little bit more, it's easier to add on that patient who needs to be seen during the lunch hour, or stay a little bit late to answer patient messages and the like, and just not be so selfish. But when you're really under a lot of pressure, it's very hard not to think about yourself. The next thing is I think it's important for doctors to do things to make them feel connected to their patients. When I attend National MS Society events or volunteer, or when I do these social media things on YouTube and Twitter, it really makes me feel more connected to the multiple sclerosis community and hopefully more empathetic. Now, Dominic was talking about a very specific issue related to clinical care, and there are a lot of technicalities here, and of course, there are many clinicians or people with MS who may simply disagree with his philosophy. But I do think there's a general inefficiency in these treatment algorithms, and I do have a proposed solution. I think when deciding on these guidelines, you should get multiple people together that have a vested interest. This includes people who are important, like administrators and pharmacists and finance people, of course, but also the doctors who treat these individuals. For instance, when talking about multiple sclerosis drugs like Lemtrada and hematopoietic stem cell transplant, you need people who are experts in this disease and these treatments. Professor Gavin Giovannoni shouldn't just be blogging, he should be on these committees, or at least people like him. Also, you need patients and patient advocacy groups there to express their own interests. And all of those people can sort of get together and make a shared decision. And I'm not suggesting that we just give people everything they want. Obviously, people request medications that are not appropriate all the time. And of course, it's unethical to prescribe medications where the risk clearly outweighs the benefit. And of course, regulators can't just say yes to everything. They have to balance the budget, or else they'll go broke and it won't be there, the resources, for other needed treatments. However, I think people aren't as selfish as you think when we take a look at the big picture. People will say, you know, we really need this, but we don't need that so much. We can sort of give and take and find something that works for everything. And I have some ideas on this topic that I'm holding back, which maybe I'll talk about in a future video, that are a little bit technical, and you do have to be an expert on the specific topic to talk about healthcare finance, in my opinion. But anyways, I hope you enjoyed the video, and I'd be interested again to know your own experiences. Do you think doctors are lacking in empathy? Do you think this problem is getting worse over time, or has it always been there? And what can we do about it? Do you agree with my suggestions, and are there other things that we can do?